Hi, my name's Jory, and I'm serving as a mental health therapist here at Lower Lights Health. I'm going to be speaking over this slide today as we talk about mental health for parenthood. Congratulations on stepping or continuing into parenthood. What an exciting time for you and your family. Thank you for joining us and taking the time to understand your body, your mind, and your needs during this precious time. This week's topic in our series focuses on the importance of your mental health while caring for you and your baby. We know there is a link between a parent's mental health and the development and health of their baby. Your well being is the foundation from which your baby develops, and this can actually have a lifelong impact on your child's health. Talk about the power of a parent's love. It is empowering to know that you can care for the well being of your family even before they are born. There are many ways that we can care for your baby, and one of those ways is knowing your needs and creating a calm, safe, and secure environment as possible for you and your baby, which starts with your own mental health. It is important that you understand what is happening with your mind and your body during this precious time. Some of the material will focus on the mother or gestational carrier or surrogate of the child, while other material will focus on both parents and or caregivers in general. The World Health Organization defines mental health as a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and is able to make a contribution to his or her community. Many factors contribute to mental health problems or concerns, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, family history of mental health problems. There are many ways that our bodies can tell us that we're having concerns with our mental health, some of which I'm sure you've heard before. These include eating or sleeping too much or too little, pulling away from people or usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches or pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared, yelling or fighting with family or friends, experiencing severe mood swings that can cause problems in relationships, having persistent thoughts or memories that you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, or inability to perform daily tasks like taking care of your kids or getting to work or school. Some of these symptoms are signs of mental health diagnoses such as anxiety or depression. You may have heard of something called postpartum depression. It is actually now referred to as peripartum, which means depression that occurs during or after childbirth. This is not the same as the baby blues, which we often hear and associate with a mom's change in hormones. Around 70% of women experience the baby blues, which is often a short-lasting condition that does not interfere with daily activities and does not require medical attention. We know that the symptoms of this emotional condition can include crying for no reason, irritability, restlessness, and anxiety. These symptoms last a week or two in general, and they typically resolve on their own without treatment. Peripartum depression is emotionally and physically debilitating and may continue for months or more. Any new mother or gestational carrier or surrogate can experience symptoms of peripartum depression or other mood disorders. Women are at increased risk of depression during pregnancy and after pregnancy if they have previously experienced or have a family history of depression or other mood disorders. If they are experiencing particularly stressful life events in addition to pregnancy, or if they do not have the support of family or friends. We can look for peripartum depression by looking for feelings of sadness or having a depressed mood, loss of interest or pleasure in activities that you once enjoyed, changes in appetite, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposelessness, Purposeless physical activity, inability to sit still, pacing, hand wringing, or slowed movements or speech. These actions must be severe enough to be observable by others. Feeling worthless or guilty, difficulty thinking, concentrating, or making decisions, thoughts of death or suicide, crying for no reason, lack of interest in the baby, not feeling bonded with the baby, or feeling very anxious about or around the baby, feeling of being a bad mother, fear of harming the baby or oneself. You should contact your doctor immediately if you're experiencing several of the symptoms above or for more than 2 weeks. You have thoughts of suicide or thoughts of harming your child. Your depressed feelings are getting worse, or you're having trouble with daily tasks or taking care of your baby. New parents in general, both male and female, are also at risk for peripartum depression. Young fathers, those with a history of depression, and fathers with financial difficulties are at increased risk of experiencing their own depression. Our mental health impacts how we bond with our baby and how our baby grows their attachment to us. We know there is an extreme importance in early bonding with your baby and the impact it has on lifelong mental health and resilience of your child as they grow. Bonding is the process of an emotional relationship between mothers or caregivers and babies. Pregnancy and postpartum periods are the most important for developing a mother-child or parent-child bonding. We know that human babies are born very dependent of their parents. They undergo huge brain development, growth, and neuron pruning in the first 2 years of life. The brain development of infants, as well as their social, emotional, and cognitive development, depends on the loving bond and attachment relationships with their primary caregiver, usually a parent. There is increased evidence of various studies that neglect, parental inconsistency, and a lack of love can lead to long-term mental health problems as well as reduced overall potential and happiness. That is according to NCBI Winston. Depression and other health concerns can impact how we're interacting with our baby. Depression level during pregnancy and postpartum period depression and anxiety levels negatively affect mother-baby bonding in the postpartum period. We found that as prenatal attachment level increases, the level of postpartum bonding also increases. This is according to National Library of Medicine. NCBI also states that we know if positive experiences do not happen, the pathways needed for normal human experiences may. Even though babies have a deep genetic predisposition to bonding to a loving parent, this can be disruptive if a baby's parents or caregivers are neglectful and inconsistent. Building secure attachment is the process of making sure your baby feels secure and safe and you're meeting their needs. NCBI also states the most valuable gift that a child can receive is free. It's simply a parent's love, time, and support. This is no empty sentiment. Science is now showing why babies' brains need love more than anything else. When babies develop a secure attachment bond, they are able to 1. Develop fulfilling intimate relationships, 2. Maintain emotional balance, 3. Feel confident and good about themselves, 4. Enjoy being with others, 5. Rebound from disappointment and loss, and 6. Share their feelings and seek support. If you are facing difficulty with bonding with your child, please talk to your doctor right away. The love you share with your baby stretches over generations, as your baby will know how to love their future babies. Bonding is not always immediate, but there are things that you can do to improve this with your baby to build trust and meet your baby's needs. Bonding with your baby starts with yourself. Secure attachment starts with taking care of yourself. Babies can communicate most effectively when they are in a quiet and alert state, and so do you. As hard as it may be, it is important to take care of yourselves in order to build a secure attachment bond with your infant. 1. Try to get enough sleep. Sleep deprivation can make you cranky and irritable. 2, ask for support around the house. 3, schedule some time away. Finding ways to calm yourself in stressful times is very important. Take a deep breath. Team up with people around you to take care of yourself and your baby. And lastly, take a walk. Some fresh air and a change in scenery can do a wonder for you and your baby. It is also important to remember when building a strong foundation for your child's life, they experience events just like you do as adults, just in a different capacity. Their life exposures also impact their mental and emotional health. It's important to limit exposure to adverse events. Adverse events and adversity is a broad term that refers to a wide range of circumstances or events that pose a serious threat to a child's physical or psychological well-being. Common examples of childhood adversity include child abuse and neglect, domestic violence, bullying, serious accidents or injuries, discrimination, extreme poverty, and community violence. That's according to childtrends.org. We often think that because they are babies that they cannot remember what's going on around them, but the exact opposite is true. The environment that your baby is around impacts your baby's brain development, and if they are exposed to violence, arguing, neglect, such as not being soothed when they cry, not being fed or changed, this will change the makeup of your baby's brain. The younger a child is, the more susceptible they are to being impacted by these adverse events. Preventing these events not only helps your mental health, but also the mental health of your babies for years to come. 5 ways to improve your overall mental health in everyday life, according to Sun Life, is 1, set small goals for yourself. Don't get ahead of yourself. Be easy on yourself. 2, maintain healthy habits, such as get enough sleep, nutrition, and exercise. 3, ask for help and build positive relationships. 4, ease back into work after maternity leave. 5, stay in touch with your doctor. According to mentalhealth.org, ways to maintain your mental health include getting professional help if you need it, connecting with others, staying positive, again, getting physical activity, helping others, getting enough sleep, and developing coping skills. Seeking support within your life is also very helpful. Church, home, family, friends, these help combat everyday stressors and allow you to celebrate with others. Professional support is also very important, and you should seek out support if you're in a position where you're needing additional services. Linking with ongoing counseling services through Lower Lights Health is an option. If you need to see someone urgently, we would happily work with you to find someone who you can see for ongoing care. It's important also to reach out to emergency supports. You are not alone in experiencing, if you are, suicidal thoughts, including not wanting to be here anymore, or homicidal thoughts, but there is help. You do not need to suffer from this, and it is important not to ignore these thoughts. In Columbus, any nearest emergency department can also help you, as well as NetCare. Thank you for taking the time to watch this training. If you have any questions, please reach out. And if you need to talk to someone ongoing, we're more than happy to help you. Again, congratulations.